Okay, we're going to go ahead and get started here. So this is Introduction to Primitive Reflexes. This is talking about chiropractic neurology for pediatrics or the pediatric population. So basically functional neurology in kids. My name is Dr. Bryan Royer. I am a board certified functional neurologist and I have over 900 hours in the diagnosis and treatment of different neurological disorders. I have had a bunch of different training with the assessment and treatment of childhood neurobehavioral disorders. Also have a handful of other different specialties and certifications and such. So that's a little bit about me and why I'm talking. But let's talk about what we're going to talk about here for the next hour or so. So basically the idea of what we want to do is we want to try to learn and understand about how the brain develops and how it works and why it does what it does. Again, the general idea is that if you can kind of like figure out how something that's made and how it actually works, then that's one of the ways that you can help to fix it if it doesn't work properly. So what I'm going to do here is I'm going to actually show a little bit of a video. This video, not going to show all of it, but we're going to do, this is from a TED Talk. This guy's name is Dr. Daniel Wolpert. And he is basically a British medical doctor. He's a neuroscientist. He's an engineer. He has done different stuff in England, like Cambridge and Oxford and all that other kind of stuff. But he's going to talk a little bit about why we end up having a brain. So I can talk a little bit about this, but we'll let him do it because he does a pretty good job. You know, it's a TED Talk and all. Oh, of course. Let me back that up. My bad.
I want to start with the easiest question, and the question you really should have all asked yourself at some point in your life, because it's a fundamental question if we want to understand brain function. And that is, why do we and other animals have brains? Not all species on our planet have brains, so if we want to know what the brain is for, let's think about why we evolved one. Now, you may reason that we have one to perceive the world or to think, and that's completely wrong. If you think about this question for any length of time, it's blindingly obvious why we have a brain. We have a brain for one reason and one reason only, and that's to produce adaptable and complex movements. There is no other reason to have a brain. Think about it. Movement is the only way you have of affecting the world around you. That's not quite true. There's one other way, and that's through sweating. But apart from that, everything else goes through contractions of muscles. So think about communication, speech, gestures, writing, sign language. They're all mediated through contractions of your muscles. So it's really important to remember that sensory, memory, and cognitive processes are all important, but they're only important to either drive or suppress future movements. There can be no evolutionary advantage to laying down memories of childhood or perceiving the color of a rose if it doesn't affect the way you're going to move later in life. Now, for those who don't believe this argument, we have trees and grass on our planet without the brain, but the clinching evidence is this animal here, the humble sea squirt. Rudimentary animal, has a nervous system, swims around in the ocean in its juvenile life, and on some point in its life it implants on a rock, and the first thing it does in implanting on that rock, which it never leaves, is to digest its own brain and nervous system for food. So once you don't need to move, you don't need the luxury of that brain. And this animal is often taken as an analogy to what happens in universities when professors get tenure, but that's a different issue.
So there's a lot of stuff that's in there. Again, you can kind of see how when it comes down to it, again, the idea is that we end up having a brain because of the idea that we have to respond to our environment, right? So when you take a look at the general purpose of the brain, you end up having like three general different kind of things that it does when it comes down to it. So if you look at the brain in general, let's kind of like highlight some of this stuff here. The first kind of thing that the brain is going to do is it's going to help to perceive its environment. So it's going to take in information in from the world. And when it helps to take that information in, it will help perceive what's going on. But that's not the only step. Like, you have to perceive the environment, but you have to interpret what all of it means. It's one thing to be red, it's another thing to interpret what the red in the stop sign means versus, you know, red on, you know, lipstick or any of those other kind of things. There's different meaning that's associated with them, so you have to interpret them, the meaning. You know, a dog that comes at another dog might interpret it one way, but if that dog is, you know, coming down and has its, you know, face down and its butt is up in the air, that is a visual indication for another dog that the dog is playing. So you have to have the right interpretation that it comes down to in the brain. And then you respond or you don't respond, which is also a response. So depending on what it is, so whether or not you're too hot and you go and move into the shade, or if you're thirsty and then you end up, you know, drinking water. Again, the response ends up being either a motor movement or it ends up being a behavior. Okay. So these are the general kind of things that happen with the brain when it comes down to it. All of these different things are associated with, again, trying to survive, trying to live, that kind of stuff. But the thing that's interesting though is that we have the general idea of what happens with the brain, but we also have this other thing called a reflex loop, where you end up getting a perception of what's going on, but you don't really interpret it. You just make a response. It's an automatic kind of a thing. So there's multiple different types of reflexes. The reflexes that most people think of when we talk about it, like anything that's medical, is that you talk about like a reflex that, you know, when someone smacks your knee with the reflex hammer and the leg kicks out, that would be this example here, or smacking someone's tricep. And again, this is, you know, another example of what's tested where you use the reflex hammer and it causes an automatic movement. That's not something that's supposed to be something that a person is going to do on their own. They're not supposed to move it on their own. It's supposed to be an automatic reflex that's there. And the thing that comes down to it is that reflexes are important for a couple of different things. Is that it ends up being an automated response that we end up having in our body, and it's there in order to help to facilitate life. It's supposed to help you to preserve it and to do different things that's there. They help to push higher brain functions. But again, there's like an irony that goes along with it, is that they help to develop higher brain functions. Again, some of them, maybe not all of them, but they help to develop higher brain functions, but you don't need the brain in order to actually like do it. So it's a way to interact with the environment without needing a brain to interpret or perceive or anything like that of what's going on. So again, you don't necessarily need a brain when you do that. So one of the examples that I had given was the example of that reflex where you get smacked with the hammer. Another example is that if you ended up having some kind of movement that's over here, again, if you see the pointer that's there, you should have your eyes pop over to that and you should look at that when it ends up moving, right? That's a specific reflex that we have because, again, it's a protective thing that helps to facilitate life. If you're looking off in a different direction and some kind of movement happens in your periphery, whether or not it's something that's like this or whether or not it's something that pops in over in a different place, what ends up happening is that you end up having different issues that are associated with the movement. Um, you end up having the different issues that are associated with that kind of movement where your body is going to try to pay attention to it, and you pay attention to it, and that's going to be something that, again, it could be a threat or some other kind of thing along those lines, right? You do the same kind of thing with a sound. If you ended up having a sound that you could, you know, locate where it was coming, and if it was coming off and down to your left, you're going to hear the sound. And if it's not something that you know what, you know, like obviously know what it is, you're going to go and you're going to try to look and try to find out what kind of information that is. Both of those are reflexes. Both of those are kind of mediated by the same area. Again, one of the things that's there that ends up being that is that some of these reflexes you can actually inhibit or you can kind of shut down. So if you end up having something that's like this, and if I, you know, tell you to, I want you to just look at this point that's right here, that little like, you know, gleaming part of the graphic that's there. And if I tell you to look at the graphic and don't look at the red when it's over here, when it moves over in your field of view and don't follow that red, again, that is a version of paying attention. As this moves around, your body wants to look at it because it's something that's stimulating. But because you're into focusing in one area, you can actually shut it down. Same kind of thing with a sound, you can shut it down. That would be involved in concentration. A kid that has ADHD, you start flashing stuff that's over on the side, and they're not going to be able to inhibit that type of reflex. Another reflex would be the pain withdrawal reflex. So that would be the idea of if you reach out and your hand touches like a hot stove or something that's hot, you end up pulling back. So you withdraw and you flex your body in and you pull something back into your body. So that would be something, that would be there. So touching a hot stove. The other example for parents would be something along the lines of stepping on a Lego, right? You step on the Lego, you're going to stand up with the other one and you're going to pop up and you're going to pick up the other foot pretty quick because, that usually hurts and all that. So there's a general kind of pathway that happens from conception to adulthood where there's certain things that happen in a pathway. This would be an example of like a vase, right? And the environment that's in the vase, again, all that, you can equate this with what mom is, right? So again, this is the environment that's going to help to grow something. Obviously a baby, that kind of stuff. But in the case of this, we're talking about a plant, right? So in that case, you start having, when you're not going to get into the full birds and the bees in this one, but when you start talking about conception is going to end up having something like, in this case, we'll use the analogy of having a seed. So you start off with a seed, and that seed can sprout, and it's going to start to grow. As a child grows, it's going to go through certain types of processes that's going to increase, that is going to, in its maturity, that like as it matures, it's going to go through certain processes um, that are typical. So as you go through, and you eventually end up having, something like birth, and then from there you would progress, and as the child starts to grow, the child would grow roots, the child grows a stalk, you know obviously the child's not growing these things, but that same general idea. As everything is going to progress up, you're going to start doing different things where you would grow, and you're going to lay down other types of milestones at certain ages, right? So again, walking happens at a certain age. Talking happens at a certain age, and everything kind of goes until you get to a point where you start growing. The larger kind of system that's going to be there, right? So there's a specific kind of order that things develop in a flower, but there's also an order that things are going to develop in a person. One of the things that's associated with how all of this grows is this concept called epigenetics. So the idea of epigenetics is that you end up having an environment, and then you also have protein synthesis. So your genes are going to be responsible for actually making proteins. And as it goes through and it makes those proteins, it is going to be influenced by your environment. So anything that can affect the transcription, the translation, or protein synthesis can cause epigenetic changes. So basically, you can end up having, there's studies that will show that there are certain types of epigenetic effects that can happen in an adult that will affect their children. So people that are not very, if they're not moving a lot, if they're very sedentary, that can actually kind of shut down certain types of good genes that we don't want to be shut down, right? Again, a lot of movement and a lot of stimulation and that kind of stuff has the tendency to turn some of them on and help to make them work. So that's the general kind of idea of what happens with epigenetics. In general, a fetus does have certain senses that are built into it. You end up having certain things will develop first. And there's a certain pattern to way that things develop, just like when we talked a little bit before about the flower and how the flower actually grows. There's a specific order that you're going to end up having development that happens with a fetus as well. So they talk about, the general ideas that you can compare because it's a mini evolution that really happens. Most people don't realize that at some point when you're going through the stages. You actually develop gills, and then the gills disappear. There's develop other kinds of aspects that are there, but there's a bunch of different things that happen where you end up having things that end up being similar to a fish, where you do have vestibular function that develops. You do start to, again, have some types of movement in the proprioception. You end up getting, there's a certain degree of vision, again, obviously not very much light, but you do have that, some hearing, some tactile senses moving around, but obviously there things are, you know, a little bit dulled when it comes down to it, because obviously of being in the mom, but you end up having the heartbeat that the baby can hear, other external environment, movements and other kinds of stuff will be present that a fetus would be able to actually feel. And that whole process of how things develop, this is an example of a couple of different pictures that you end up having here of the brain. And this is the same kind of view, the same kind of look of the different areas of the brain. And one of the things that's interesting is that this ends up being like the brainstem area that you have. So that would be in through here is going to be the brainstem. This down and through here ends up being the spinal cord, just like this is the spinal cord in through here. But the brainstem is going to be one of these kind of it's going to be an area that basically has to do with reflexes and automatic functions and different kinds of stuff like that. And this area of the body has the tendency to develop first, right? The spinal cord is going to develop first, then you're going to end up having the brainstem. Then some of the lower centers in the brain are going to end up developing. And then you end up having the larger areas of the brain. So the cerebrum, which is the areas up and through here, are going to end up developing eventually, right? So different kinds of sections are going to happen, and they happen in kind of a sequential order, right? One of the things that happens is that when you go from being a fetus to now all of a sudden you're born, one of the things that's not there is that in the womb you end up obviously having water. There's not really a vestibular system in the sense that we would think of. So vestibular system is basically talking about balance and which way is up and right and all that other kind of stuff. So once the baby is born, you end up adding in gravity, and gravity is going to end up having a whole change into it. Again, gravity, is going to affect something that's in the water, obviously, but you end up having a different kind of impact when someone's, like is in the water and swimming around or floating in a pool or something like that, versus if you're having to actually resist the pull of gravity. So in the womb, the baby hasn't had the opportunity or the need to actually like to resist gravity. So once that gravity comes into play, that's where you end up getting a rapid section of neurological development, right? You start pushing things. And in that first year of life, your body, like a baby's body, is going to develop around 4 million new neurons about every minute right at the beginning, like as it's going. Again, this isn't an automatic process. It needs to have stimulation in order for you to actually develop this. So again, when a kid is younger, you need to make sure that you're stimulating their senses. Again, vision may not be great. In that case, hearing isn't going to be great at the beginning, because those are going to be things that are going to develop a little bit later on. But the things that are particularly impactful for kids end up being vestibular things. So that's going to be bouncing, right? That's how you take a child, and obviously one of the many different ways that there are in order um, to stimulate a child, to get them to stop crying. These are going to be things that are inputting into the brain. So vestibular, the bouncing up and down, the rocking back and forth, those kind of things are going to be things that will help to stimulate the brain. Proprioceptive. Proprioception is talking about the idea of movement. So when you're talking about the general idea of, having the baby on his back and running them, right? Taking their feet and moving them back and forth, moving their arms, playing with their hands, doing all that other kind of stuff. You're assisting with the movement, but that proprioception, that's moving the body, and that's helping to move the baby as well. Um, and that's helping to stimulate the brain. Then the other thing ends up being tactile. So all of the different types of pressures, the different types of things, like the touch just in general. Like, again, all of that stuff is going to be stimulating for the baby. So, but the thing to kind of come down to is that you're talking about the first year of life. You end up having all of these neurons that are there, but the development doesn't happen continually. You end up having all of these neurons that end up being made, but just like when there's too many choices to be made, it slows down the choice. The body will end up paring some of them down. So it actually makes a whole bunch of different connections, but then after it makes those connections, it starts to basically shut down the connections and basically prune the tree to for like a version of talking about that. So you need a lot of stimulation in order to do this. And this is to the point where, and you may not like the idea of this, but there's been studies that have been done with cats where they help the cat and they don't help the cat. They basically raise the cat in a way so that the feet never touch the ground and they never let them explore. Obviously, this isn't done all the time. This is a study that I remember learning about being a biology student, is that they would take these cats and they would make it so that they would never touch the ground. They would, raise them so that they, were always basically being held, but their feet weren't touching the ground. And the thing that was crazy is that the cats were blind when that something like that happened because they didn't have the ability or the need to actually move around in their environment. They never developed the ability to actually see because that wasn't an automatic kind of a thing, because they needed to actually like do it. And then after a certain point, like, there would be a certain point where the cats would not be able to actually like gain vision. If you if you deprive them enough, then it's like at the beginning you could add that and you can actually like get them to actually be able to see, but after a certain point then you weren't able to do it. So when it comes down to it, the thing is that again, you start developing all these connections at the beginning, but the other end of the spectrum is that you end up having this frontal lobe that is in the brain that is the last thing that ends up getting fully formed and fully um, matured, right? Frontal lobes aren't going to be matured in younger kids. They end up being matured in, you need to hit a certain age, and we'll talk about that in a little bit. But you need to hit a certain age before the frontal lobe is matured. The sensory systems start functioning when you're in utero. So, like when you're in the womb, you can actually start sensing and feeling and different stuff like that. But again, only the spinal cord and the brainstem is formed. So again, there's not major functions that are there. And because that there's not really any type of interpretation that's going on with any of it, they're basically just functioning off of reflexes. And again, the reflexes are only going to be that perception and then the response to stuff that's going on. So again, they can, start driving processes, but both that perception and the response are going to start to drive neurogenesis or drive the beginning of the formation of the brain and making the brain form correctly. So when it comes to assessing kids, and the reason why we've been talking all about this is that this is part of the reason why we start getting into these primitive reflexes. You got to start with the basics. So when it comes down to it, there's a certain number of primitive reflexes that are available. So the primitive reflexes, again, you can call them Palmar or the grasp reflex. The STNR is the symmetric tonic neck reflex, spinal galant, spinal Perez. There's rooting, there's Babkin, plantar, the asymmetric tonic neck reflex, Babinski, the tonic labyrinthine reflex, or the TLR that's there, hand pulling, Landau, Moreau, and then amphibian. There's a handful of different things that are there. I'm not going to cover all of them that are there, but again, the general idea is that these reflexes are going to be present in an infant in order to drive them to be able to cause a movement. And they develop in certain times and then they disappear. And that's one of those kind of things that ends up being kind of interesting. So the first one, this is the Palmar or the grasp reflex. This is the one that most everybody knows. You start taking a younger child, like an infant, and you basically put your finger in their hand and they will hold on for dear life and they won't let it go till, for anything, right? And again, this starts to develop at about 12 weeks post conception. Again, it is a reflex, but it starts to integrate, or it starts to disappear at somewhere between the ages of 9 to 12 months, right? Again, these are all like milestones that you can actually look for. So it's supposed to disappear by the time that the child is 9 to 12 months. In fact, it can actually disappear a little bit before that. So it should be gone by the time 9 to 12 months, but a lot of times it's gone by the time that the kid is 4 months old. So again, that's something that's there that can help the baby and the mother bond. Again, oxytocin, again, you're providing tactile feedback, you're stimulating the hand, which is a really large center that you have in the brain. It helps to start to develop some hand-eye coordination, again, especially for feeding and knowing where things are. But here's the thing is that, again, this is one of those things that's supposed to be gone at 9 to 12 months. And in older children or even adults that end up having a persistence of this reflex, again, it's something that's easily tested. But if you end up having a persistence of the reflex, you can end up having issues with poor penmanship or difficulty holding large objects or other issues that are like that, right? So the other one, or another one to talk about, is the asymmetric tonic neck reflex. This one is basically pretty simple, where you can see on the picture here that this child ends up having a bent arm, a bent elbow that's here, and then a bent knee. And then if you notice and you look at the other side, you end up having it straightened out on this side, and the leg is straightened here, with the child's chin pointing towards this side. That's a common kind of thing that happens. So you end up, if your kid turns to the side and they look to the left, then they end up sticking out their left arm and they end up sticking out their left leg and they draw in the other side. It's one that happens, top and bottom, and it's a typical thing that happens. Again, this one is also going to be something that has the tendency to start around 12 weeks after conception, and usually it has disappeared by the age of about 6 months. Again, this is one of the things that helps the body to twist when it comes to the birthing process. Again, that's some of the theories of why it's there, but this is also going to be generated, this whole idea of a cross-body proprioception. So this is kind of part of the cross crawl. It's not exactly the cross crawl when people talk about that. So what I mean by the cross crawl is that if you talk about a baby on its hands and knees, when it moves its hand forward, it usually is going to end up moving the other leg. So that's the cross crawl kind of technique. This is usually something that's a little bit different, but it's the same general idea, is that you start moving the head and the head starts to move the arms and the legs. Now, the issue with this is that sometimes this can be something that persists, and in something that is persistent with it, you can end up getting clumsiness. You can end up having issues with gait or dropping things or having, again, a persistent grasp of different things as well. The next one to talk about is the spinal galant, and spinal galant is going to be where you end up touching on the back of a baby. And again, you could do this on an adult, and you basically take that, and again, not a lot of pressure, but enough pressure that maybe it could, almost think about it tickling. It's not really tickling the kid because that's going to end up being a different type of perception. So when you do that, you put your finger on and then you rub it down towards the edge of the diaper. Again, this is going to be something that is going to develop at about 20 weeks post conception, and it helps to uh, get the child out of the birth canal. It should be gone by the time that the kid is about 3 to 9 months old. And this is going to aid in the vestibulospinal tract. So vestibulo is talking about the vestibular system and balance and knowing where your body is in space. This is going to be one of the things that's associated with helping that to develop. Now, the thing that's interesting is that you start getting issues with this, and you start getting, when it's persistent, you can get fidgetiness in the chairs because the back of the chair actually stimulates the reflex and it makes the kid want to move. If it's persistent on one side, it's possible that it could contribute to scoliosis. This and the spinal parese has been linked to being present in bedwetting, low back pain, other kinds of pelvic torsions, and stuff like that. So there's a handful of different things that are associated with this. And again, this is one of those where like you can test this on just about anybody. You have them go on their hands and knees. You would basically start up near like the mid back and then go down towards the butt just off of the side. again, not on the line where the bones are for the spinous processes here, but just off the either side. And basically what would happen is that you kind of like arch the butt and you kind of like lift up, and it kind of like, it's almost like you're being tickled is the movement. But that shouldn't be something that you actually end up getting in the baby, right? Or in an adult or in a child. But this is one of the things that's there. Another one ends up being the rooting reflex. And again, this is something that ends up developing at about 20 months post conception. Rooting reflex is what it's talking about, is just like it shows in the picture, is that it's going to be about actually rooting at the breast or at a bottle in order to actually like to take in nutrition, right? So trying to get milk, trying to get nutrition. This should be gone by about 6 to 9 months. And again, this is going to be part of breastfeeding again, until they're able to seek food and use their hands to put things in their mouth and stuff like that. So the things about when this is present is that when it's present, you can end up having issues with ticklishness around the mouth. Again, they can suck on their thumb maybe for a little bit longer. There can be certain oral fixations. And basically what happens is that if this is not present, this is one of those kind of things with a failure to thrive or when a child has a problem, is that sometimes this is something that a kid maybe didn't latch very well at all. Again, it's, there's all kinds of different things that happens with breastfeeding and that kind of stuff. And whether or not the child latches, again, sometimes moms end up, having problems because the kid doesn't latch, and it's not the mom's fault. It a lot of times can be that the kid hasn't developed this reflex well enough yet. But in other cases, people can have the reflex persist longer than what it should. So again, it's one of those kind of things that it should be gone by the time that someone is about 6 to 9 months. And then at that case, then it's going to end up being a voluntary type of reaction to actually do the nursing at that point, as opposed to a reflex that's going to automatically do it. The other one would be basically where if, like, the as opposed to doing a rooting reflex, it would be like actually, trying to suckle, where if you end up getting some kind of stimulation to a cheek, that the mouth opens up and then the head turns towards it. That's going to be another thing that's going to be obviously very much related to a rooting reflex. Babies don't know that they need to eat. They don't know that, that this is something. They just know that they get mad if they haven't had food. So the idea is that when it comes to both of these together, this is what drives the kid to actually eat. Okay. Next reflex is called the Babinski reflex. And the Babinski reflex is going to be something where you, just like it shows on this picture here, you start on the heel and you come up on the side. Maybe not go across the side, but if you go up like this, you'll notice this big toe will come up. And this is something that's supposed to happen in a baby, right? If you're talking about a young child, when you reach up and you try to do that, that toe will go up every single time. As the child gets older and they start trying to, they've been crawling for a little while and that kind of stuff, and they start pulling themselves up onto things, you're going to start getting that Babinski reflex to go away. So this definitely should be gone by the time that a kid is a year old. Again, the thing that's interesting is that the presence of this in adults or in children is usually considered to be a major sign of brain injury or a stroke or paralysis or different stuff like that. Again, in the lack of a trauma that's there, often like it is there on occasion in people without having those major kinds of brain injuries or problems. So the next thing to talk about is this thing called Moreau reflex. Moreau reflex is basically, again, develops between the 12th and 13th week of gestation, and it should be gone by the time that the kid is about 4 months old. It is looking as something that is a startle response for the protection of the lungs. So this is when, like one of the ways that, like when people do the swimming with infants and stuff like that and being able to dunk them under the water, the way that they do it is by initiating the Moreau reflex, because not only does it make them go from this curled up kind of a position into their arms popping up and their mouth opening. When that happens, they also have the tendency to not breathe. So they basically help to protect their lungs. and it kind of goes from there. So the thing is that it's connected to a handful of different things as well, right? So SIDS, when it can be problematic with that, again, for the protection of the lungs if it's not developed enough. If it's still around, again, you can have hypersensitivity. Anxiety is a huge one with this, right? Increased IML activity, that means increased sympathetics or fight or flight. So the adrenal hormones can be popped up. For people that have spinal galant, which is the one that we talked about where you're stroking the back, that's going to be something that's there. And this is something that is a really easy test. You would hold a child like upright. Again, you're supporting the child, making sure that they're not going to fall, but you're holding them, cradling them in your arms with your hand holding their head and basically their feet straddling the other part of the arm. And then you kind of like make them fall back a little bit, controlling their head, making sure everything is good. And their arms will pop out just like it shows in through here. And depending on how much that you do it, you can make a kid cry, but you'll basically see their arms pop out to the side when they're there. Okay. So this is Moreau reflex. The way that you do this and you test this on an adult is you have them do a trust fall. If the kid or the adult can't do a trust fall, then Moreau reflex is basically still intact. And again, it's something that is going to be very much associated with anxiety. Okay. So when you start talking about the different areas of the brainstem itself, this is kind of like when you're developing at the beginning, right? So the brainstem is this lower area that's associated down in through here, the lower area of the pons and the medulla and all that other kind of stuff are going to be associated lower down. Um, the brainstem, like I said before, it has important functions, but it's fairly simple and it's basically to help keep you alive. It's basically to regulate blood pressure, it's regulating heart rate, it's regulating skin temperature, the blood flow, the different tones in the muscles and such. So there's a whole handful of different things that happens with the brainstem. Okay, so the cerebellum is going to end up being another area that's associated down here, and it's actually very much associated with the brainstem. But the cerebellum is going to be something that is associated with integrating information and helping to coordinate body movements. So whether or not it's coordinating movements, emotions, or thought, when you're trying to recall memories and different stuff like that, the cerebellum is also involved in that as well. It is going to be definitely associated with coordination, balance, and orientation. Okay. So the next level up is that the frontal lobes is going to end up being the next level. And again, this, like I said before, you end up having a couple of different lobes in the brain. You have the occipital lobe, which is associated with vision. You end up having the temporal lobe, which is associated with laying down of memories and sound. And then you have the parietal lobe, which is sensation for the most part, right? There's a couple others that are in there, but those are the main lobes that you end up having in the brain. Those are the most advanced kind of things that are there. The frontal lobes are going to be associated with behavior and with movement. So when it comes down to it, for the most part, women have their frontal lobes matured by the time about that they're 20, and men have them matured by the time that they're 24. So it's one of those kind of things where, again, guys sometimes do dumb things and they do dumb things well into their 20s. This is one of the reasons because they don't have an frontal lobe that's able to actually inhibit some of those actions. Again, the frontal lobes are going to end up being involved with the sensory integration in the different areas of our brain. So you sense things using your parietal lobe, but you're going to interpret and use those sensations in order to drive your behavior based on how the frontal lobe is functioning. So again, frontal lobes end up being changed with chemicals and drugs and different stuff like that. Concussions can have an effect on it. Oxygen deprivation can have an effect and cause brain changes. And degeneration can obviously have issues as well. Again, this is going to be like the flower part, that last part to develop that's there. And the area in the frontal lobe, again, it's generally going to be the CEO that you end up having in the brain. So it's going to take all of the information, it's going to integrate it, it's going to basically evaluate everything that's going on, and then it creates a plan and tries to execute the plan properly. So it happens in different sides and different stuff. So, like the left side of the brain controls voluntary movement on the right side of the body, but it also does things, on the same side as well. So the reason why I talk about all of this stuff is that, again, these things happen in order. Is that your spinal cord is going to be the first thing to start to mature, then your brain stem is going to be maturing, then you end up getting cerebellum, and then you end up getting the cerebral lobes, with the last of them being the frontal lobe. The idea is that these primitive reflexes that we were talking about, they exist in the brainstem. So they exist in the medulla, which is down near the bottom, the pons, which is in the middle, or the midbrain, or the mesencephalon, which is up at the top of the brainstem. All of those different things should be happening, and they're going to mature in order, starting at the bottom, moving their way up, and it actually wraps around the brain, where the last thing to mature ends up being the frontal lobe. The reason why all this stuff is important, and why we were talking about the issues with primitive reflexes in the first place, is that primitive reflexes, again, for the most part, like we talked about, should be basically gone by the time that a child is 1 year old. And the whole point of actually testing for these primitive reflexes is that if you're going to end up having some kind of an issue, if, let's see if I can get myself back here and take a look at one of these different um, pictures that's there. So if you're going to do something that's like this, right? In this case, with this child, with the arms moving back and forth, if you turn the kid's head to the side and this arm moves and this one extends, and then you turn the kid's head to this side and this arm extends and this one doesn't, and there ends up being some different issues with it, you can assume that there's some kind of motor damage to the arm. And that's the issue that happens. And that's why you end up having these reflexes. The reflexes are typically going to be something in the body or something that a pediatric neurologist is going to be able to use. And again, pediatric medical neurologist is going to use to be able to figure out what the problem is and what kind of, issue is going on with the kid. The issue is that after a kid is 1 year old, most of the time these don't get tested for. And again, if they don't get tested for, does it matter if they persist or not? What happens if they still exist and you have a 13-year-old kid and they still end up having Moreau reflex, or they still end up having some of this? The thing that's also interesting with all of these is that they should be gone by the time that you're 1 year old. But as certain neurodegenerative processes happen and as they progress in Alzheimer's and Parkinson's, these primitive reflexes will actually come back. You'll actually start getting Moreau will pop back, and you'll start having other kinds of problems, and they can be associated with different issues. So I'll bring all that stuff up, and without being too boring, hopefully, one of the things that we look at next is this issue of science and what does it say when it comes to these primitive reflexes. So there was a study that was done that looked at preschool kids, and they found that over half of the preschool kids in this study ended up having retained primitive reflexes. So again, over half of them had it. There was, maybe 11% of them that had no retained primitive reflexes. But you ended up having a link that you would have with this, where the greater the severity of the reflexes that the kid had, the greater of the motor efficiency was lower. So another way that you could say that was that kids that have the tendency to have higher amounts of these primitive reflexes, or have the primitive reflexes be stronger, meant that they weren't, like, from a motor standpoint, they weren't as developed as what they should be. The thing that's interesting about this is that this is generally associated with other kinds of neurobehavioral disorders. So when you talk about things like ADHD, autism, oppositional defiant disorder, the processing types of disorders like auditory processing or visual or sensory processing disorders, and many of the learning disorders like dyslexia, dysgraphia, dyscalculia, dyspraxia, all of those different ones have the tendency to have certain degrees of these primitive reflexes that are associated with them. Okay. The thing that's important though is that when it comes down to it is that these reflexes will persist in some kids, but just like we talked about before with the stimulation at the age of 1, where you start to stimulate them and they start to get a lot of growth of the neurons based on the stimulation, same kind of thing can happen. Again, maybe not quite as fast a little bit later on, but you can get the same kind of pushing that happens that helps these different areas of the brainstem to mature. And you can reduce or you can even eliminate some of these primitive reflexes with exercise, right? So certain exercises that are done. So in this study that was here, and this guy, Dr. Malillo, is one of the people that actually helped to train me. Is that this study looked at 2,000 individuals between the age of 3.2 and 22 years old that were diagnosed with just attention deficit disorder. They had them go through a 12-week program where they were doing different activities in order to reduce the retained primitive reflexes. And in that process, they started to notice that one of the things is that not only were the primitive reflexes reduced, but they also started to improve their motor and their cognitive measures significantly. So, for example, like the listening comprehension was significantly increased between before and after. So again, you're talking 12 weeks. So 7%. In that case, that you can talk about like 1 or 2 grade levels that you can have of an improvement in like just months, right? The other one that you can have would be like mathematical problem solving. So that one was increased by 5%. And again, both of those were associated with a significant reduction in the amount um, of the primitive reflexes that were still being retained. So the general idea is that the brain needs to be coordinated. That has to do a lot with timing. And again, if you start talking about an orchestra, things need to be coordinated together. Again, you have a conductor who's having a good time, he's enjoying it, right? But you have a conductor that's going to be helping to coordinate everything together. Again, just people playing and doing whatever they want isn't going to necessarily sound pretty. But if you can coordinate the woodwinds and the strings and the drums and everything together, that's going to be helpful. If the flutes are on one type of a drug, right, and the drums are on another, that are might be an upper or a downer or whatever kind of a thing, you're going to end up having issues with it and things aren't going to sound very good. So that's a classic kind of example of what it's like in order to help to make things function. You want things to function, you want things to be strong, you don't want things to be overbearing, right? So just like the frontal lobe, you don't want it to be overbearing in certain things. You don't want there to be too little action in one place and too much action in another. And that's part of what we're doing when it comes to taking a look at some of the treatments that are available for this. So when it comes down to it, you can apply this neuroscience that what we've been talking about and develop this whole idea of neuroplasticity. Neuroplasticity is where you end up taking a where you end up basically changing the way that the brain functions and improving connections in order to actually help to improve a situation, right? So basically, by firing certain pathways, you can make the pathway stronger. And if you do it not just haphazardly, if you do it in a way to improve function, you can end up um, making major changes in the kid's life. So, for example, right, again, I'm not talking about a kid, I'm going to talk about a dog, right? If you talk about like teaching my dog how to stay, right? My older dog, we did a much better job. My younger dog, we didn't do that great of a job. But when you talk about teaching them to stay, it's sit, you get them to stay, you give them the treat, you hold, you wait a little bit. And then as you keep going, you get them to hold longer and longer and longer and longer. The longer that they hold, the more ability to hold and to be able to control their behavior that they have than another dog that does not know how to do that. So the more that you build that up, it has different implications. So a hyper dog, if you can get that dog to sit and to stay and to calm down, they're going to be a much better behaved dog in general than a dog that was never turned or taught how to sit or how to stay. It's the same kind of thing with the neuroplasticity with people. Same kind of thing of what we were talking about, where if I say, I want you to look at this edge right here of that, and if you have some kind of movement that happens over here, if you practice ignoring this and just focusing on the one spot, even if I'm moving this around and through there, you should be able to continue to look at the one spot, even though it's moving back and forth and trying to distract you. The better that you do it and the more that you do it, the better off that you're going to get at doing that type of activity. Okay. So there's different ways that you can do this in order to help to figure out what's going on with the person. So there's autonomic assessments that can be available. So again, this is the classic kind of stuff that we would typically do where we're doing blood pressure, heart rate, looking at the oxygenation and the temperature of the person. And there's a handful of other things that you would do. Again, the reflexes and stuff like that that I've already talked about. There starts to be, this is like, that's part of it, but then it can go into a full on neurological examination. Part of that exam could be something to do with eye tracking. So this would be like an example of a pair of goggles that I have here at my office. And the goggles that I end up having at my office here, uh, again, they have little cameras that are in through here that will let you see in the dark. And you can actually like see how the eyes are moving and how they track, whether or not they're holding still, whether or not they're doing a bunch of jumping or whatever else is going on. This would be another thing that we can do some testing on when it comes to balance. So balance how you are with your eyes open or with your eyes closed, how you are standing on something that is not a firm surface that's going to it's going to be a harder thing, and you can use the joint position sense or not use it depending on what you have that's going on. So there's a couple of different ways that you can do evaluations with some of these things. But once you try to figure out what's going on, you do a evaluation over a handful of days. You're going to get a bunch of data, and then you're going to try to actually help to make the brain work a little bit better. So when you do that, you're going to end up using exercises in order to basically push the brain. You want to do exercises that are going to help to develop strengthen pathways and make things work a little bit better. So some of the ways that you can do that is by using the different receptors that we have on the body. So the receptors that we end up having in the body are going to be associated with taste, smell, sight, touching, movement, hearing, and then again, vestibular information. So what happens is that all of that stuff that comes in, again, whether or not it's taste or sight, again, hearing or vestibular information or that, all of that's going to come in, and it's going to come into the thalamus of one of the parts of the brain. After it comes to the thalamus, it's going to go up and it's going to stimulate the cortex. And once it pushes the cortex, it'll move its way down here to the pontomedullary reticular formation, which actually goes down and it controls autonomics, which are the idea of the blood pressure and the heart rate and other kinds of stuff that's going to be associated with that. So all of these different sensory receptors and information are going to come in, and it's going to affect the function of the brain. Once we know that the brain is working well, then you can actually, with the brain working well, the brain will do a better job at controlling things that are downstream. So when it comes to all the stuff that what we've been talking about, like again, working on different aspects of getting the proprioceptive, or I'm sorry, getting rid of the primitive reflexes, the primitive reflexes are going to do a better job at working the different areas to stimulate the brain to make the brain work better. Okay. When it comes down to it, again, these receptor therapies, again, we talked about using taste, right? That could be something, using smell to light up the brain and make it work, using vision, using hearing, using different types of movements, whether or not it's movement of the body or whether or not it's movement of the eyes. The eyes are very much wired in to these brainstem areas, and the more that you can make them work, the better off that something's going to be. Working balance would be another one that was like an extremely important thing. things that you can also add to, and again, there's a whole handful of different things, would be things like hand-eye reaction time. So the latency would be like when one of these different lights up, how long does it take for the person to reach over and hit it, right? Do they hit it right away? Do they have like extremely fast reflexes where they see it, they react, and they do the actual movement? So there's different aspects of this hand-eye coordination that's there. Are they accurate when they hit it? So these are some of the things that we look for, but these are the things that you can actually work when it comes to improving how your brain works. So different hand-eye reactions are there. The next thing that we would have would be, one of the things besides some of the stuff that we've also talked about is that some of these things could also be involved in using an app. So this is an app that we use in our office where we would actually get a person signed up for the app. They'd be able to download it on their phone. And then once they download it on their phone, they use a specific code that was sent to them so that they can actually like do the app. And I can see how well that they're doing, but you can also see how um, not only can I see how well that they're doing, but you can also track the progress of how a person is doing over time. So these are some pretty cool little apps that you can use. Okay. And the next thing that's here, the last thing, is that one of the things that we can use is neurovisual therapy. So dealing with like the perception of space using both eyes to do it. Um, Looking at something up a little bit close where, or versus far away, how accurately that you see somebody, how quickly that you can search your visual fields for different things and knowing whether or not they're the right distance away from you or not, right? Knowing about faces or knowing about objects or environments and where things were in space. And again, eye movements in certain aspects of the visual field, all of these are different things that are going to be things that can be associated with improving the coordination and the timing and everything of the brain. So part of it is going to be like with the things that we talked about. Part of what we talked about is going to be associated with primitive reflexes. That's one of them. But just with all of this other kind of stuff, the idea is that you want to try to figure out where the person is, first of all, what they're capable of doing, and then try to, just like you're exercising a muscle, you want to try to push them a little bit in order to strengthen the pathways that they have. So that is basically that. If you are interested in having yourself or a child evaluated for primitive reflexes, that would be something that you could go ahead and call the office. We could get you in, get you scheduled, and get all of that stuff started. So go ahead and take a look at the website if you have a chance. Again, it's besttoledochiropractor.com. Like us on Facebook, subscribe, and all that other kind of stuff. Thank you very much.